My name is Holly Drover and I'm a physiotherapist, where my interests are around addressing health inequalities, particularly in something called pulmonary rehabilitation. This is an intervention for individuals that are living with long-term lung conditions and breathlessness. Part of my PhD involved a big data analysis that was exploring inequalities in enrolment, completion, and effectiveness of pulmonary rehabilitation. And it found that there are huge inequalities in access, but if someone completes pulmonary rehabilitation, that whatever your characteristics, they'll gain a significant benefit. So actually, we really need to work on increasing access. So alongside co-contributors, which were people living with breathlessness, their friends, their family, and their carers, we looked at adapting pulmonary rehabilitation for South Asian individuals in Leicester. The process took about a year in total, so it took a really long time, and a big proportion of that was building my networks, building trust with local communities, and for me to become a trusted professional. But it was so valuable because there were no dropouts in terms of the co-contributors, and it goes against all the evidence in the area of this. And people shared such valuable and personal stories, and all of these helped in the adaptations of pulmonary rehabilitation. Whilst future research is needed in evaluating the intervention, immediate implications were we had co-designed resources such as how to use translators effectively and a communication preferences sheet so that people can receive the information how best suits them. But as well as this, the individuals involved now report that they have an increased trust in taking part in research. It seems less scary to them, and they've gone on to take part in future trials, which has diversified the participants in those. They've also gone on to be part of the patient public involvement and engagement groups, again increasing the diversity of these groups, and these will have an impact on future clinical studies. And because they took such ownership of the project, it wasn't just my project, it was theirs too. We've worked with them to set up a Breathe Easy group, which is a support group for people living with long-term conditions of breathlessness. And this helps support manage their condition, and it ensures that the impact of my research is sustained long beyond the life cycle of the project.